been looking at social media to find whether or not, because I'm afraid of what I'm going to see. I have a fear that, like the Terry Schiavo case, that there are going to be proud progressive Democrats who point their fingers at anyone who prayed for Charlie Gard, who was willing to send money to the family to bring little Charlie into the United States, or to send an American doctor there. That they're going to say, "See, I told you so. The science doesn't lie. He was going to die anyway." Well, you're only really excited about the death of Charlie Gard if you have no children of your own, or this didn't happen to you, because no normal parent would receive a death sentence from their state healthcare system. I mean, the hierarchy of their government-run healthcare system, and just shrug their shoulders and accept it. Any normal parent would look for any ray of light, any beacon of hope, any light at the end of the tunnel. And when an American doctor says, maybe we've got 10% here, well, that's 10% more than you had the other day. But it has unfortunately come to an end. And it looks like what many knew to be true, even though they were praying and hoping for something else, that unfortunately Charlie Gard will die. But when I hear this father's pain, when I hear him, I can only imagine what that must be like. I mean, we all beg. We all beg God for a healthy child. How many people have you heard say, I just hope it's healthy, right? You know what? You want a boy or a girl? I just want healthy. And to know that this father was told, this mother was told by their government that, no, we've decided that your child is going to die this way, and we don't want to hear any of this outside influence. I can't imagine the pain this man has gone through. I can't even begin to fathom it. I can't even begin to understand it. I don't think most of you can either, unless, I mean, you've been through this. I don't know you. I don't know everyone out there listening. I hope your children were all born healthy, and I hope you're raising them to the best of your ability. That's what I sincerely hope for you. But to have this man's government tell him that in their estimation, this child was born to die, and they weren't going to have any interference by any other system or practitioner that may challenge their edict, their ruling. There's only so much you can fight this. And again, I want this to be understood. If Mr. Gard were a member of parliament or a prominent family, the system would not be treating his son this way. And you have to understand something, that this system that you're seeing right now is the system the Democrats want to bring to the United States. I want to read to you, because no one ever has the guts on the left to talk about this. This is from Dr. Ezekiel Emanuel's own words. The man who, on one side, we had Jonathan Gruber, who designed the economics of Obamacare along with others, and then the influence of Dr. Ezekiel Emanuel. I want you to listen to this. Youngest First. Although not always recognized as such, Youngest First allocation directs resources to those who've had less of something supremely valuable, life years. Dialysis machines, scarce organs have been allocated to younger recipients first, and proposals for allocations in pandemic influenza prioritize infants and children, has suggested a strict age cutoff for scarce life-saving interventions. Whereas Alan Williams has suggested a system that allocates interventions based on individuals' distance from normal lifespan if left unaided. Prioritizing the youngest gives priority to the worst off who would otherwise die having the fewest life years, and thus fundamentally different favoritism towards adults or people who are well off. Although allocating preferentiality to the young has an appeal that favoring others worse off individuals such as women, poor people, and minorities lacks, because all people of age, treating people differently at different ages, different does not mean that we are treating persons unequally. Prudent planners would allocate life-saving interventions to themselves earlier in life to improve their chances of living to old age. These justifications can explain much of the public preference for allocating scarce life-saving interventions to the youngest people. Okay, so there's the explanation. Now listen to what he writes. A strict youngest first allocation directs scarce resources predominantly to infants. This approach seems incorrect. That's Charlie Gard. The death of a 20-year-old young woman is intuitively worse than that of a 2-month-old girl, even though the baby has had less life. The 20-year-old has had a much more developed personality than the infant and is drawn upon, and it goes on, the investment of others to begin as a yet life unfulfilled project. Youngest first allocation ignores this prognosis and category excludes older people. Thus, youngest first allocation seems insufficient on its own, but it could be combined with the prognosis and lottery principles in a multi-practice allocation system. Essentially, it goes on, and I can't read the whole thing, to say that the 20-year-old girl has been the recipient of social investment in public education, job training, and thus the society is best off by treating this person because this person will pay off in the end. In other words, if society is to run everything, then society has to get a benefit from its investment, a return on its investment. So this 20-year-old girl has 20 to 40 years of productivity ahead of her. The 20-month-old baby or 2-month-old baby has had no social investment and isn't worth it. That's the complete lives system. He writes this unapologetically, that your baby isn't worth the investment by society. As if you're supposed to play Mother May I with society, which is run by a governing class which would never treat itself that way. Do you think if this was someone in the system who was famous or directly connected to government, that this is how they would treat that baby? If Charlie Gard's last name was more important than Charlie Gard, that baby would quietly be receiving the best of everything. It's right there. You can read it for yourself, the complete life system. It's not some secret document that only I have access to. It's right there. Ezekiel Emanuel is telling you in the system that medical treatment is only granted by the system based on the system's belief that this person is worthy of the treatment. The fact that you love your baby, we have to get over you loving your baby. This isn't about you loving your baby. This is about social investment in the system, except when it's someone in the system's baby. If this were Chelsea Clinton's baby, nobody would be talking about denying that baby anything. The little people are just numbers on a spreadsheet. That's it. Are you worthy to the system? Do the people who've lucked into the job of distributing health care think you're worthy or not? Do you think they treat each other like this? Do you think the guardians and philarchs of the national health system in England would treat one of their own babies or their colleagues' babies this way? You know damn well they wouldn't. There's a VIP line and a line for everyone else, but everyone else pays for the system. I've pointed this out to you. What you pay into the system is mutually exclusive from what you receive to the system. So if we had true free market health insurance in this country, upon finding out you're pregnant, you'd be able to go to your insurer and say, look, I'm willing to pay this premium in case there's something really wrong with my child. I've got 3 kids. I can't imagine what this man went through, and I would have a hard time believing that he even knows that this system was in place before his girlfriend got pregnant. Read it for yourself. It is a document of death. Hawaiian 695 Patriot 957-2874. We are right. They are wrong. That is the end of the story. The arguments on this radio program cannot be broken. Sirius XM Patriot.